Good evening, everyone. The title of my poster is Clinical Profile and Outcome of Acute Pancreatitis in a Secondary Hospital. Acute pancreatitis is an inflammatory disease of pancreatitis, which is one of the common differential for acute abdomen presenting to emergency, and global prevalence of around 1.8 to 2.9%. My objectives were to assess the clinical profile, to assess the severity and outcomes of acute pancreatitis in a secondary hospital. So it's a retrospective cross-section study conducted in medicine department in Chittoor CMC between January 2019 and December 2022 of patients who were admitted with a diagnosis of acute pancreatitis. So there were totally 138 admissions with the diagnosis of acute pancreatitis, and majority were between the age group of 25 to 40 years, and around 60% were males. So there was an increase in trend of pancreatic admissions with diagnosis of pancreatitis over the years. The most common presentation which we have noted was abdominal pain with vomiting. There were other cases like patients who came with DK hyperemesis gravidarum, who was later found out to be having acute pancreatitis as well. And there were 8 cases of acute on chronic pancreatitis. The most common etiology was found out to be ethanol related, which was around 68%. Followed by idiopathic, where we couldn't find the cause, and also gallstone related, which was around 15%. So sonographical evidence, like based on that, the most common feature was bulky pancreas, followed by heterogeneous echo texture and peripancreatic fluid. Patients had systemic complications like ascites, pleural effusion, and septic shock as well. 22.4 patients required antibiotics due to various reasons like fever and septic shock and other concomitant infections. And 35% had organ involvement like liver, kidneys, and lung involvement. So 15.8% patients presented with severe disease, and the severity was calculated based on modified Atlanta's criteria. There were 9.5% who were admitted in ICU, and 9.54% were referred to a higher center. There was a total of 35% who came with recurrent episode, out of which 95% was due to ethanol use. So the odds of getting a severe disease in patients with comorbidities was 2.8 times, so which is statistically significant. And the BISAP score calculated at admission within 24 hours had 100% specificity, but only 20% sensitivity in predicting the severity according to the modified Atlanta's criteria, which according to our study. The average duration of hospital stay was around 4 to 5 days. And I conclude by saying that the acute pancreatitis can be managed, and there was only one there during the whole study period. So it's quite a low mortality rate, and acute pancreatitis can be managed in secondary hospital. But with the recurrence rate high among the alcoholics, there was only 25% of the patients who followed up in psychiatry OPD. So we can prevent the recurrence by improving the compliance to follow up in psychiatry OPD de-addiction methods and all, because ethanol was the most common cause associated with recurrence.
Just a question. Is there a prognostically difference between ethanol and non-ethanol?
So most of because the majority of the patients were ethanol, so the severe disease patients who present with severe disease was also shown with ethanol use. So it's not
64%.
68%.
You do the analysis to see whether is there the difference between the severity and the...
I did not do the analysis.
Dr. Supriya, wonderful results. 1% of your patients of 136 acute pancreatitis seen in a 3-year period, mortality was only 1 patient.
Yes, sir.
That is excellent result. So it's a very good result comparing that they got severe and so reclassify your diagnosis of acute pancreatitis, because I am seeing only ultrasound findings, edema, enlargement, calculi, etc. Agreed. But you have not done serum lipase levels?
Yeah, we have done, sir.
All of them confirmed. So what is your criteria for making diagnosis of acute pancreatitis?
So the Atlanta's criteria,
yes, sir. Atlanta guidelines?
Guidelines, yes, sir.
Everything, all 100% was Atlanta guidelines?
Yes, sir.
That's what you have said.
Yes.
Very good. So you acute pancreatitis, then you've got recurrent, is classified in 4 ways. Acute pancreatitis. Second one is relapsing pancreatitis. Third one is chronic pancreatitis. And the fourth one is chronic that is fibrocalcific disease of the pancreas. So you're saying all this is acute pancreatitis and some are relapsing because of
Yes, sir.
recurrence.
They
recurrent
had
cells.
recurrence, yes.
And the cause is alcohol, gallstones.
There was idiopathic, 20% had
That is
we
something
couldn't
like
find the cause.
causes.
We couldn't find the
And classification predominantly male,
males.
no female.
70% were
In that
males.
there is no female.
Mm.
Why?
So I didn't get
This
it.
is, go back to your record. I'm wondering why. No disease has got, that means it's a male disease.
So ethanol.
Where is the female?
Why don't you say, because
With the
males
diagnosis.
take alcohol more.
So like almost everyone, 100% of the alcohol abuse was among the males.
No, I'm not saying anything, but I'm wondering why. Now, one is hyperemesis gravidarum, one.
So
But I want to know total number of females. It's
So
not
sorry,
there.
it got cut off, sir. It's
there?
75% males. It's there, sir.
Where?
So it got cut off with the graph. I'm sorry.
Okay,
It's
it
a-
may
it
have
was-
gone hidden. Okay, so that's very fine. You work on this and now what next? What next?
So we wanted to increase the follow-up rates. This like majority of the recurrent rates was among the alcoholics, but only 25% of the alcoholics had a follow-up in psychiatry and de-addiction methods.
So you're saying if anybody gets acute pancreatitis, we'll send to you, Chitur, 1% death only. You know, why is that so? Why, you now find the reason why you're only 1% is dying.
Ali-
Did you do a severity scoring at presentation?
So I've calculated based on the BISAP score, I have estimated based on the blood values and the vitals checked at the presentation.
Was established severity
So
score?
most of the like ransom scoring and all couldn't be established because most of the investigations were not ordered in the secondary hospital.
Because it only means that most of your pancreatitis that presented to you were of the mild type. And they did not have it. And naturally, because you are a secondary level hospital.
Yes,
Therefore, people with very severe disease would have gone.
we're not gone, yes.
Thank you.